Thank you, sir, and thank you, Dr. Anurag, for setting the stage. And it's my duty here to speak on the other side. So before we start, there is a problem is that who needs to listen? If you are a vegetarian, then probably you do not need to listen to my side of the talk. Your choice is already made. So diet itself is a choice, and that's the most important part of the diet. So you look at I think Dr. Anurag had presented the map, which was based on a study in 2014. This is the latest updated one presented in 2019 based on National Family Health Survey. And you can see a total number of vegetarians in the country is only 19% of the population, 13% of men and 25% of women. That's all. It's not very great. And if you move from the western side all the way down to the eastern and southern side, you can find the number of vegetarians are coming down. At the same time, you compare the incidence of CKD, prevalence of CKD, it is the same all over the country. So the prevalence CKD is not matching the vegetarianism of the population. So there is no epidemiological connection, at least between the two, at least in India. Of course, this is very gross data, and I won't ask you to depend on this alone. But let us go to it. What is a plant-based diet? So like my opponent said, it could be a vegetarian-vegan diet, or it could be a lacto-vegetarian. It's the most common all over the country. Or it could be lacto-ovo-vegetarian diet, which includes eggs also. Or it could be semi-vegetarian diet, which includes some chicken, some fish, but excludes other type of meat, red meat, etc. Or it could be a flexitarian diet. It accepts all type of meat to a lower quantity, but still plant-based. And Mediterranean diet, DASH diet, blue zones, these are all variously classified as plant-based diet. Mediterranean diet is not a plant-based diet. It's got sufficient amount of lean meats in it. DASH diet also includes meat into it. And this blue zones diet is the diet which is in the population where the age, the people live to very old age, like Okinawa and Japan and all that. So the average age of the population, the age of death, more than 100 years. And they have around 80% plant-based, but 20% of meat-based. So none of these are actually plant diets. They're actually just plant-based, but they contain a lot of mixed diet in between. So it depends on what type of diet you use. And the basic fact is that there is no proper definition. So you can use anything as a plant-based diet. And the other problem is that what is the extent of this thing? So when you talk about plant-based, I say limited quantity of meat, but what is the quantity? That is not really safe. And if you have a large amount of eggs and dairy, that is not really a plant-based diet. But if you have a small amount of meat added, that is actually a plant-based diet. So which is a plant-based diet? Again, there's a problem. What all is included in the plant-based diet? Again, you have a problem. And what about processed plant food? That is actually bad. So you see, these two are plant-based diets, both on the left and right. But no, I think all of you will agree with me, right side diet is not recommended for any type of person, for a normal person or for a person with low GFR. It's a very unhealthy diet. You wouldn't want to prescribe that to anybody. And then you have a lot of studies which are being mentioned. So how did these studies assess the diet? So there are many of these studies, most of them use dietary questionnaires, but some of them, many of the larger ones used a 24-hour questionnaire. So when the patient came, they just took the last 24 hours what they ate, and that was used for following the patient for 10 years, just one questionnaire. And some of them took a frequency of intake of 60 to 124 items. So they just gave an online questionnaire or a questionnaire to the patient, and they gave 120 items, and how frequently do you take this? More frequently, less frequently, etc. And that was used as a conclusion. Some studies scored the intake of various food groups. So you say this is a group of whole grains, then fish, then seafood, then meat, etc. And these are again a baseline data. Some studies took the data more than once. And then when you have RCTs, they selected based on adherence to prescribed diet. So there are two types of RCTs. One, you select the patients, see whether adherent to diet and take those patients. Another thing, you just take the patients and then put them on a diet. And that's what happened in the MDRD study, which I think Dr. Nayak roundly criticized out here. And so let us look into some of these studies and what they actually say. So this was the NAINS study, and this was what already has been quoted by one of the speakers. And you can see that the NAINS 2 actually had about 1,065 patients. And when you do a continuous model, there seems to be a decline in the worsening. There's progression of CKD over these three models. But when you put quartiles, that is quartile 1, quartile 2, etc., depending on the increase in the plant protein ratio in the diet, you can find that there is some amount of benefit which is there. But you can see the confidence intervals are not very great. And the source of animal proteins in this diet is not explicitly mentioned. They just said more plant, they just quantified the plant, but not what the animal diet they were taking. So some of them may have been taking red meat, some of them may have been taken only eggs, etc. And if you look at the patients who are taking a more plant-based diet, they had a healthier lifestyle, and they were mostly the upper social strata. So they had access to better tools. And of course, there was some amount of adjustment for these parameters in this, but it was not absolute. That is there. And look at the next one, nurses' health study. This has also been quoted in this, and there was 1,624 women. And in the EGFR category, the total nurses' health study included 1.2 lakh people. But this was about 1,600, almost 99% were white women. There's hardly any other women in this population. And if you look at the EGFR, they were studied between 1989, they were selected, and they were followed up for a period of 10 years. And you can see that as the amount of total protein intake was increased, their decline in GFR also increased. And you can look at those who are taking 90 gram of protein, that's a very high amount of EGFR decline. But in the other groups, the EGFR decline is not stable. It is varying. So if 6.9 is 1.87 is the odds ratio, but at 75 it is only 1.56. So there is, as it increases, it seems to decrease and then go back higher. But of course, 90 is very bad. So this is a total protein intake. If you look at plant, non-dairy animal versus dairy and vegetable, both, they say the non-dairy animal protein, the amount of worsening was very bad. But you look at the other values, you look at the confidence intervals here, this is between minus 2.8 to plus 4.4. Now, if vegetable protein were a drug, would you approve this drug for a use in patients? You would not. This will not satisfy any of the criteria. No FDA approval will be received for this type of confidence interval in this trial. So I cannot say that this is actually a win for vegetarian diet. It is actually just some data showing that there seems to be a propensity for benefit. That's all. Nothing more than that. And if you look at what is non-dairy animal protein, that includes eggs, that includes fish, that includes chicken, and that includes red meat. So everything comes in this non-dairy animal protein. And some of these are actually considered as healthy, some of these considered as non-healthy. So again, these are not factors which have been, these confounding factors have not been looked for in this trial. And the Crick study, so this has also been quoted. And you look at the data from the Crick study, you can see that if you look at the overall plant-based diet, there seems to be some benefit in the two. But if you look at, once you've done the modeling for all the residual confounding factors, there is hardly any benefit for the plant-based diet. So that is, as you increase the tertiles of PBD score, the improvement in the GFR decline, slowing of EHR was not very great in any of the populations. So it is actually, the Crick diet did not really recommend a plant-based diet except in the terms of overall protein, and that is without confounding factors. So the actual models did not show any benefit even in the Crick trial. And then CardioPrev trial, this is a Mediterranean diet trial, and they had 4 groups in this based on obesity and DM, obesity plus type 2 DM, no obesity, no type 2 DM, obesity without type 2 DM, and type 2 DM without obesity. So 4 groups were there. And if you look at the 4 groups, all of them seem to show some amount of benefit for a Mediterranean diet versus a low-fat diet. But only in the group with obesity and T2DM, the Mediterranean diet had an actual significant, statistically significant benefit. So if you are a diabetic who is obese, the Mediterranean diet is useful for you in preventing progression of CKD and reducing mortality. But other groups, it doesn't help. And a Mediterranean diet is not just a plant-based diet, it also allows lean meat and red meat intake to some extent. But still, it showed efficacy in some groups of people, even though it is not a plant-based diet. And this is one of the largest cohorts which was the UK Biobank cohort, 4,807 patients. And this was based on a dietary questionnaire which was at the beginning of the study, based on the food groups. And they were based on healthy plant-based diet versus unhealthy plant-based diet. So that was the criteria. And if you had a higher scores on healthy plant-based, you were put on a health, that was given preference. If you are given higher scores on unhealthy plant-based diet, you are put in that group. And if you are taking more of animal protein, you are put on an unhealthy plant-based diet group. So that is how they manufactured. And they followed up these patients for 10 years based on a questionnaire at the start of the study. And all of them had a low EGFR below 60 at the time of study. And you can see that over the years, the healthy plant-based diet, there seems to benefit, but unhealthy plant-based diet, the actual increase in the mortality was much worse than the decrease in the mortality on the plant-based diet. So a plant-based diet has to be a healthy plant-based diet. And just because adding animal diet to it does not actually improve things. So they show the healthy plant-based diet is better than an unhealthy plant-based diet, but that does not mean that a plant-based diet is really beneficial. So all plants are not equal. That's what I would like to say. So from all these cohorts, what you say that a healthy plant-based diet is the one that is unhealthy plant-based diet is bad, causes mortality. And a Mediterranean diet also improves mortality, which is not a plant-based diet at all. So healthy food and unhealthy food, that may be a better thing to do, and there is no debate on that, actually. And you look at ketone logs, I think this study has been shown by Dr. Nayak also in his presentation, and So what I can say, this is actually an interesting study, Garnieta study, and they had 1,413 patients in Romania, and only 42% agreed to take away and put in the trial. And of these, 1,206 were eliminated due to not meeting eligibility criteria. What is the not meeting eligibility? They were not able to adhere to the diet. So finally, only 207 were randomized out of 1,413. So only 14% were randomized. And those who were randomized either received a VLPD with a vegetarian diet with keto analogs or an LPD 0.6 gram per day. And here, this data shows a fantastic difference between the two groups. So giving a keto diet really seems to reduce the progression to ESRD, but you can see the lines are not all that great. And the amount of dialysis difference is probably because they were taking a high amount of keto analogs in those studies. So the problem with this is that only around 15% of patients can be convinced to join a low protein diet. And these people are committed. So if you have the small 1 in 10 persons, you can put them on that low protein plant-based diet and they will be successful. 90% will not be successful, even in our population. So the thing is that even in the patient like Hyderabad, you're taking mainly a plant-based diet. Hyderabad is famous for its biryani, but who will be taking mutton biryani every day? It's not possible. So in most studies, compliance to low protein diet is only about 20% to 30%. So that is one of the problems with all these trials. So finally, if you overall conclude what's the evidence for PBD, you have some observational data, but observational data should always be taken as an association, not as causation. So that itself is not a great data. Take it with a pinch of salt and not more salt because we are dealing with CKD. So the message that PBDs are effective for preventing CKD progression, this slide seems to be moving faster than I am talking. This is at best preliminary and refutable, and maybe related to healthy diets rather than the plant-based diet. So what you should recommend is actually healthy diet, not plant-based diet. Whatever you are taking, if it's a healthy diet, that's good for you. And finally, we have been discussing low protein diets. How do low protein diets actually improve CKD? It was all based on 1920 studies in rats, and where they showed hemodynamic changes in the glomeruli, which actually prevent the progression of CKD. And you have much better drugs which act in 100% of patients. RASIs, SGLT2 inhibitors, MRAs, and now even the GLP-1 analogs, all of them do that. So with these drugs, diet is going to play only a marginal role in preventing progression of CKD. So might as well enjoy a good, healthy diet based on the background of the patient, not just a plant-based diet. And if you are going to have dialysis 3 months or 4 months earlier, that's not a great compromise. That's what I'm going to say. Thank you very much.